Hello and welcome to this week's episodes. Last week we started off this series of infertility. Today we're going to look at the main causes of some of the main causes of infertility, and especially in women. We did mention a bit of tubal factors, that's blocked tubes, which do cause infertility. We also want to talk a little bit about endometriosis, which also causes infertility. About fibroids, there is misconceptions and facts and myths about fibroids and infertility, and also the more talked about and most misunderstood condition, which we call polycystic ovarian syndrome, or PCOS. So today those are the things which we're going to look at, the myths and facts about them, one by one. Now, one of the commonest in our setup in Kenya and in Africa as such, one of the commonest causes of infertility in women is tubal blockage, where the fallopian tubes are actually blocked. And most often than not, they are blocked because of previous infection. You find a lady may have had a pelvic inflammatory disease, an STI, that's a sexually transmitted infection, or any other bacterial infection, which may cause abnormal vaginal discharge, which would generally be foul smelling, with low abdominal pains that can go either untreated or sometimes can be treated. But if it's treated late, then you may find that the tubes may get affected. And later, you may find a woman is having problems conceiving. So the tubal factor, mostly because of infection, it's one of the commonest in our setup. The other problem, which I think previously, years ago, we thought we didn't have much of it, but we seem to be diagnosing a lot of it nowadays as part of infertility causes, is endometriosis. What is endometriosis? Endometriosis is basically when you have the same tissue, which is usually inside the uterus, but now it is abnormally located outside the uterus. So it is not within the uterine cavity, it is now outside the uterine cavity, outside the womb. So it may be on the ovary, it may be on the intestines, it may be on the fallopian tube, anywhere in the pelvis, but sometimes it can actually be anywhere in the body. Now, the problem with that is that when one is having menstruation, that particular tissue which is in an area which is unusual also bleeds, just like the uterus would bleed to release the menstrual flow. So you find if it's, for example, on the ovary, the woman will also bleed from the ovary, from that abnormally located endometrial tissue. That's what we call endometriosis, because you have a tissue which is abnormally located outside the uterus. And that causes problems because the same tissue responds to hormones the same way the uterus does. So why is that a problem? The problem with that is, as the woman menstruates every month, she has this bleeding which accumulates in abnormal areas in the body, and especially the pelvis. So this blood clots there, it stays there, it organizes there, it causes inflammation, it causes adhesions. That is when you find tissues are actually getting stuck together. So you find even the intestines are getting stuck there on that endometriosis area. You find the tubes, they get sucked into that inflammatory endometriosis area. And the result of this is you may have a distorted pelvis, a distorted and blocked fallopian tube. You may have what you call endometrioma, where the blood clot may even cover the whole ovary, and therefore even if a woman is ovulating, the egg may not be released in such a way that it can be picked up for useful fertilization. And the other thing is this inflammation which occurs, it also interferes with ovulation in its own way. It interferes with the immune system, so that ovulation doesn't occur as it should. And the woman will also be having pains, which sometimes can be very severe low abdominal pains, severe back pains, especially during menstruation. But as time goes by, because of what happens with those clots, the pain may actually be independent of the menstrual flow. So that is endometriosis. Now, the other bit is fibroids. Not because fibroids cause a lot of infertility, far from it. But you find for women who are having issues or challenges with infertility, 10 to 15% of them may actually be having fibroids. The fibroids may be incidental because a woman has stayed longer, has not conceived, and the uterus would develop fibroids, but not necessarily that the fibroids are the cause of the infertility. However, in around 1 to 3% of those women with infertility, fibroids have actually been proven to be a cause of infertility. Now, how do they cause infertility in those rarer cases? One is because they may distort the uterus, they may distort the cervix so that there is no proper transportation of the spermatozoa, the sperms, as they flow into the uterus, or as they are supposed to flow towards the fallopian tube. Or the fibroid may cause distortion and blockage of the tubes, or any other mechanical way in which the fibroids could actually block a normal motion of the ova and also of the sperm. So those are fibroids. Not very common in terms of actual causation of infertility, but they are always almost in the mix. Now, what about polycystic ovarian syndrome? As the name implies, PCOS, polycystic ovarian syndrome. Poly meaning many, cysts. So here's a case where you find the ovary has unusually many cysts surrounding it. So that's why it's called polycystic ovarian disease. But then it's not just about the ovary, the cysts. There are other things which come with it, like insulin resistance. What happens with the insulin resistance is there is inability of the body to process the sugars which we take in. Usually when you take in sugar, the pancreas is supposed to produce insulin to take care of the excess sugar which you have taken into the body. But in this case, you find that the body is not reacting as it should, and therefore that interferes with the fat distribution, the hormonal balance in the body. These are individuals who are likely to develop obesity. And with obesity, you find that excess hormones, and especially estrogen, is stored in the fatty layers. And this is a situation whereby a woman will have irregular periods, or may not even be having those periods, may skip for many months because of the hormonal imbalance. That is polycystic ovarian syndrome. It may also cause inflammation, levels of some inflammation, levels of immune response, which also may interfere with fertility, proper fertility. That's polycystic ovarian syndrome, and many things come into play. Now, what's the treatment for this in brief? I'll be brief on this. For fibroids, usually we may do surgery to remove them, but that also depends if they're justifiable in the sense that there are many and they're located in situations or in places which could be interfering with fertility. But most often than not, most of the fibroids, they could be small, they might be many, but we may not have to remove them unless there's proof that they need to be removed. For endometriosis, it depends. Generally speaking, we do use hormones, hormonal medication, but most of those hormonal medication, they tend to negate fertility because they tend to mimic menopause. So if a woman is looking forward to getting children, then we may have to use those medication very judiciously, although the hormones have a place. There's also a place for surgery. Surgery may be done to release the adhesions and to remove the endometriomas. Those are masses, which are basically collection of the blood clots of menstrual blood within the pelvis. And for polycystic ovarian syndrome, we use hormonal medication to regularize the periods, to regularize the hormones, to balance them out. And then we could use other modalities to assist the couple to conceive. And as we said last week, that could entail using ovulation induction medication, or using intrauterine insemination, or using IVF or in vitro fertilization. Those are some of the options which are open there for the woman. If the tubes are completely blocked, then we do offer in vitro fertilization, as we also mentioned previously. This is Dr. Aurora Maranga, gynecologist, cancer specialist at 𝗓𝗔𝗄 Hospital. Don't forget to subscribe and share with somebody who may benefit from this information. In case you have somebody or yourself you need consultation in terms of what we've talked about, you can look at the screen. There's our number there. You can always engage. Thank you. See you next week.